Many children struggle with thoughts they do not understand, thoughts that feel scary and confusing. They repeat actions again and again, hoping the fear will stop. From the outside, everything looks normal, but inside, the child feels tired and stuck. This is OCD, a silent mental illness that is often misunderstood. Obsessive Compulsive disorder, or OCD, is not rare. It affects children, teenagers, and adults, but in many cases, it begins in childhood. Most people think OCD means being clean or organized, but that is not true. OCD is much deeper and much harder. Many children with OCD suffer quietly. They do not know how to explain what they feel, and parents or teachers may not notice the signs. That is why awareness is so important. In this video, we will talk about 3 common signs of OCD, especially in children and teenagers. This video is for parents, teachers, and young people themselves. Understanding OCD can change lives. OCD has 2 main parts. The first part is obsessions. Obsessions are unwanted thoughts that appear again and again. The child does not want these thoughts, but they do not stop. The second part is compulsions. Compulsions are actions or behaviors that children do to reduce fear or stress. The relief is temporary, and soon the cycle begins again. OCD is not a choice. It is not bad behavior or weakness. It is how the brain gets stuck in a loop. OCD is often invisible. Children may hide their thoughts because they fear being judged or misunderstood. Some feel ashamed. Adults may say, "Just stop thinking," but it is not that simple. The child's brain does not let go. Many children live with OCD for years and may never tell anyone. That is why OCD is called a silent mental illness. The first sign of OCD in children is repeated unwanted thoughts. These thoughts appear suddenly and feel scary and upsetting. The child does not enjoy them, and they do not feel normal. A child may worry too much about germs or fear getting sick. They may fear something bad happening to their family. Some worry about making mistakes or doing something wrong. These thoughts do not go away easily. The child tries to ignore them, but they return again and again. The thoughts feel very real and cause anxiety and fear. The child may feel trapped inside their own mind. This is not imagination. This is not drama. This is OCD. The second sign of OCD is repetitive behaviors, also called compulsions. These behaviors are not done for fun. They are done to reduce fear. The child believes the action will stop the bad thought. A child may wash their hands many times, check doors or lights repeatedly, repeat words silently in their head, count, tap, or arrange things in a specific way. If they do not perform the action, anxiety increases, and their body may feel tense or uncomfortable. After doing the action, the fear reduces only for a short time, and soon the thought returns. These actions can take up a lot of time, sometimes more than an hour a day. This is a strong sign of OCD. The third sign of OCD is when it begins to affect daily life. For children, this is very important. OCD can affect school, making it hard to focus or finish homework on time. Fear and rituals slow everything down. It can also affect friendships, causing a child to avoid others or feel embarrassed, leading to isolation. Family life may become stressful as simple tasks take much longer. Mornings and bedtimes can become exhausting. When OCD controls daily life, it is no longer just a habit. It is a mental health condition that needs attention. Children with OCD often feel confused. They may ask themselves, "Why am I like this?" They feel tired, frustrated, and sometimes cry without knowing why. Many children fear telling adults because they worry they will not be understood or will get in trouble. Understanding these feelings with compassion is very important. Many people misunderstand OCD. Some think it is only about cleanliness, which is false. Some believe children will simply grow out of it, which is not always true. Others think children can stop if they try harder, which is also false. OCD is a medical condition, and it requires care and understanding. Parents should pay attention if thoughts seem uncontrollable, behaviors repeat daily, anxiety increases without rituals, or school and social life are affected. Early help makes a big difference. The sooner OCD is recognized, the better the outcome. The good news is that OCD is treatable. Children can get better, and with the right support, they can live normal lives. Treatment may include therapy, and sometimes medication is helpful. A mental health professional guides the process. Support from family is very important. Listening and patience make a huge difference. Parents and teachers can help by believing the child and not dismissing their fears. Speaking calmly and asking gentle questions matters. Avoid punishment or pressure, as OCD is not misbehavior. Encourage professional help and support the child emotionally. If you are watching this video and feel seen, you are not alone. What you feel is real, and it is not your fault. Help is available and people care. Things can get better. OCD is a silent mental illness, but silence does not mean weakness. Understanding brings change, and awareness brings hope. If this video helped you, share it. You never know who needs to hear this. No child should suffer in silence.